So hey guys, we realized that we forgot to send you a demonstration video. The shoulder assessment that we actually filmed was with the camera, so we couldn't edit it and send it out. So we wanted to record this just so you have it for practice. So I'm going to go through briefly just the comprehensive shoulder exam that we taught you, so you can have it to practice with for tomorrow. So we start with clavicle, right? So we rule out our clavicle fracture. We've done all those assessments we taught you with auscultated lungs. We've checked for diminished breath sounds, ruled out all those emergencies, and then we get into the actual soft tissue structure exams that we went over. So the first thing we'll have them do is we'll check for shoulder impingement syndrome. So raise your arms all the way up for me, just like that. Lay in the plane, forward and backward translation, looking for shoulder impingement. So do you have any pain with that? No. Nope. Perfect. Frozen shoulders next. So arm behind your back, just like this, as far as you can go. Any pain with that motion at all? Nope. Perfect. This is a very rare condition. You'll almost never see this, but we rule it out because it's really quick. Okay, so we go to elements of a rotator cuff next. So arms at 45-degree angle. This is supraspinatus muscle tendon group testing. Push down here. Any pain with that at all? Nope. I was able to do that. Arms in. Don't let me push in. This is infraspinatus teres minor. Any pain when you do that? Nope. And then finally subscap. So this arm to shoulder here, and don't let me pull up on this. Any pain with that? Nope. Same thing other side. Just like that. Excellent. And lastly, we look for slap tears here, right? That's superior labrum anterior to posterior tear. So arm out in front of you, give me a thumbs down, and then all the way across your body, and then don't let me push down. Any pain when I do that? Nope. Same thing. Other side, all the way. Perfect. Good. Just like that. We go to anterior shoulder dislocation. So if the shoulder happens to be out like this, it's going to be abducted and externally rotated, right? So this is going to the ER. We have to get this back in, and that needs to happen quickly because remember, swelling even to the tune of 10 minutes can make this really hard to reduce in the emergency room. But we want to do some things first, right? So we get an ambulance on the way, potentially, right? Vascular compromise is the thing that makes this a real bad emergency, right? So I've got great pulses, cap refills within normal limits. I don't have vascular involvement. That's great. So the first thing I'm going to check is neuro stuff. So I'm going to tap over here, memorize that feeling. Tap over here. Does that feel the same? Often it doesn't. You get axillary nerve involvement in a lot of these cases. Now I want to go to my other brachial plexus nerves. So make an OK sign for me. He's able to do that. Fingers out just like this. I'm going to squeeze in. Don't let me squeeze. Perfect. That's intact. And then finally isolate this. Give me a thumbs up and then rotate around. Perfect. All that's good. So finally, there's a case sometimes where that shoulder may have slipped and then went back in. We don't know if that's the case. There's a test for that. It's the anterior, it's the instability relocation test, apprehension relocation test. So I'm going to look for grimace here. So I'm going to arm at 90 degrees and I'm going to rotate backwards. I'm going to look for that grimace. That's the body guarding itself. It doesn't like that. It's worried about this humeral head anteriorly translating because of the instability here, right? So I'm going to relocate that with my other hand, just like this. I'm going to guard this for the body, and I'm going to move this back, and I'm going to say, does that feel better? And often that does feel better, right? Because the body's no longer worried about that slipping forward. So that's the comprehensive exam that we taught you guys in video format. Use that to practice for tomorrow, and we'll see you then.